And welcome to the Oshkosh Area School District Board of Education regular meeting for Wednesday, November 18th, 2020. Has this meeting been properly noticed?
Yes, it has.
Would you please call the roll?
Salaji?
Here.
Carlin?
Here.
Evans?
Here.
Herzog?
Here.
Olmsted?
Here.
We have a quorum.
Thank you very much. At this time, we will move on to the Pledge of Allegiance and ask Dr. Cartwright to do the honors.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next, we move on to board and administrative reports, starting with the board president report. I've had the privilege of representing this board at several meetings over the last couple of weeks. One was the Wisconsin Association of School Boards Board of Directors meeting, which was last Saturday. I've also attended 2 Wisconsin Association of School Board committee meetings since we last met. One is on equity, which fits with our strategic goal, as well as the initiative of the State Superintendent of Public Instruction, Dr. Carolyn Stanford Taylor. In addition, I attended an insurance committee meeting on the state level. The major takeaway that I got from that, I wanted to share with you. It's that if districts are not following their county health department recommendations, whether to go, for example, to go virtual or to have winter sports, the insurance carriers are stepping in. So I think that's something significant that we all should know about. I also had an opportunity to present as part of a panel today to Leadership Oshkosh. And last week I attended a meeting of the Department of Public Instruction Professional Standards Council, which advises the State Superintendent of Public Instruction on licensing issues. And finally, I attended the CESA 6 Board of Control meeting a week ago, where they reviewed an application that they had made for a statewide award. This is American Education Week, and we certainly want to congratulate and thank all of our employees for the many positive differences that they are making in the lives of our students. Your hard work and dedication have not gone unnoticed, and we truly appreciate each and every one of you. Thank you. So with that, we will move on to the superintendent's report.
Thank you very much, Dr. Herzog. We're going to go ahead and get started right away. Over at Oshkosh West Art Department recently shared their talents to help brighten the holidays for families in need. Staff members created holiday window paintings for Father Cars. The paintings will be on display during the organization's drive-through Christmas celebration, available for families to enjoy while they wait in line to gather their holiday goodies. Over at Carl Traeger Elementary, first graders recently celebrated World Kindness Day. Part of their morning meeting discussion was even featured on Do Good, Wisconsin's Facebook page. The students also kicked off a kindness-focused slideshare to spotlight ways to be kind. Additionally, Carl Traeger Elementary School artists have been busy. The school's art teacher recently created a virtual art show video to celebrate the wonderful student creations. Shapiro STEM Academy's second graders recently participated in an author celebration after completing their narrative writing unit. Students were asked to choose one story they were most proud to share through Flipgrid. While using Flipgrid, students were able to receive video feedback from an audience of classmates, staff, and families. 7th and 8th grade orchestra students at Merrill and Webster Stanley Middle Schools had an opportunity to participate in the virtual fiddle tune writing workshop with guest composer Andy Reiner. Orchestra students learned about common rhythms and time signatures in traditional fiddle tunes and were able to compose their own unique 2 measures of music. We extend our heartfelt congratulations to Oshkosh North High School alumnus Tyrese Halliburton, who is a top contender in tonight's NBA draft. We are proud to see the dedication he exhibited here in Oshkosh has stayed with him and has led him to this incredible moment. Congratulations, Tyrese. We are so excited to see where your journey takes you. At this time, I would like to remind our families of the mid-year enrollment and unenrollment period for E-Academy, which is happening right now through December the 4th. Families interested in changing their enrollment, either enrolling into or out of E-Academy for the 2020-2021 second semester, are invited to learn more and to make the right choice for their children. Families are advised to read the many resources available on the E-Academy website to understand what a change would mean for your family. On the screen, you'll see just a few examples of where I've been spending my time for the past couple weeks. As you can see, it's very diversified as we go through, and continuing to having a lot of different types of meetings. And without further ado, at this point in time, we do have some written updates to provide for you, and so I would ask for Mr. Kamer to come up and provide an informational session for us related to COVID-19.
Welcome.
Good evening, everybody.
Evening, Matt.
So as you all know, each week I provide an update, and that's mainly focused around Winnebago County's weekly data summary. So every week, the county puts out a data summary that looks at the COVID cases, not only in our county, but also in our geographical boundary of the school district. And it also has some state data. So the weekly reports cover the previous 2-week period. So the report I'm going to touch on tonight covers the period of October 28th through November 10th. And the key information that comes out of the report, first and foremost, is the case rate for our area. And the case rate looks at the number of positive COVID cases over the past 2-week period, and then it bases that on a population of 100,000 people. So the case rate for our area for the past 2-week period was 1,134.2. And it's a pretty high case rate. It puts us in what's considered to be the critically high burden level, which is any case rate that's over 1,000. And thinking about that, any case rate between 351 and 1,000 would be considered very high, and a case rate of 101 to 350 would be considered high, just to put that in perspective. So it is continuing to be an issue in our community, a lot of community spread. When we look at the individual grade levels for our students, if you remember last time I provided an update, I had mentioned that we're going to be looking specifically at OASD students and not the numbers that are provided in the report, because that could be misleading given that a lot of the students in the report are not OASD students. So based on the number of positive cases we've had with our students, at the elementary level, if you think about that burden status, we continue to be at the very high level. That's the same for middle school, where we continue to be at the very high level. And then for high school, we are at the critically high level for our burden status. So that covers the weekly report, but we're also seeing a surge in the number of cases across the state. That's no secret. If you turned on the news lately, Wisconsin is certainly one of the hot spots right now in our country. And our country is really surging for that matter. And just to put things in perspective from the state level, just today it was reported that we had a new state record of 7,989 new COVID cases. And that follows other records that were set earlier this week. The average daily case rate for Wisconsin right now, which looks at a 7-day period, is 6,563, and that's the largest it's been since the start of the pandemic. ICU beds across the state are at dangerously low levels, it was recently reported. And the average daily death rate continues to climb. For this past week, it was at 48, but just 2 months ago, when just before the surge started, we were looking at a death rate of 6. So it has climbed dramatically. And the average positivity rate right now for the state is hanging right around 35%, which is significantly higher than we'd like it to be. So all of this information has led to the governor extending the mask order. If you haven't heard that yet, that came out earlier today, and that is going to go into 2021. Also, as a reminder, we are currently partnering with UW Oshkosh and their testing site to have that available for our employees, the family of our employees, and our students. So they can go on a weekly basis to be screened. A lot of our staff have been taking advantage of that so far, which is great to see. And then, as another reminder, we have our COVID-19 dashboard currently on our website, and that tracks the number of active positive cases and active quarantines among our students and staff. But then it also tracks cumulative totals throughout the course of the year. And I usually provide an update in terms of where we're at in terms of positive cases. And just this past update, which came on Monday, we were at 277 positive cases since the start of the school year. And that includes 3,088 quarantines among our staff and students.
Excuse me, could you elaborate on the governor's mask order? What is the end date for that?
I didn't see the exact end date. I just know that it goes into 2021. I don't know if anybody else had seen that, but I don't know if they even released an end date.
Thank you.
Sure.
No, I didn't see that today yet.
I think he just went for the rest of this year, and the Supreme Court is deciding this case, deliberating it right now, so that might have a bearing on everything when they decide. And I heard they're going to decide maybe by next week.
Oh, okay.
Okay,
Okay.
thank you.
Thank you.
Does I'm sorry.
I'm so sorry.
Dr. Cartwright, go ahead.
I think it's also just for common knowledge as well, because what we're finding is a lot of times people are having a very difficult time really interpreting our matrix and what that means and what it looks like. So just informing the board that we are putting together, we've already formed a committee. So it has exec team members as well as some of our principals, in order to go in there and try to create a forward-facing document that's a little bit more user-friendly. So maybe using some signage or color coding to it, so that people can follow along with that a little bit easier as to what's the current status of the district and what does that look like. I think it's also important for people to understand that when making decisions as to what model the school district is going to be in, that this is actually a consensus decision. There's multiple individuals are involved in the conversations that occur, so that consensus can be built in order to make a decision on that. So, for example, we usually start with the health department because they, as you've heard us say many times, we're taking this in advisement and direction and guidance with the health department. In addition to that, what happens oftentimes is from there we'll take that conversation, the data and the information to cabinet. So that's all the executive directors, our deputy superintendent, our directors here within central office. We have a nice conversation about it. What does it look like? How does this impact the various departments? Where are some of the ways in which we think we might be able to go in, we may not be able to go in. I could tell you Mr. Kamer probably has seen me more in his office now over the past couple months than he has in the past 2 years since I've been here. Just in conversations, I should say longer than 2 months, but since the start of this whole thing during our decision-making process during the summer. In addition to that, we also work with our school administrators and involving them in the conversation. And then, of course, as you know, I oftentimes will call each of you individually and consult with you and get your perspective related to that and share that information out, not where it came from, but what the general conversations were before making, again, a collaborative type decision process. So I just wanted to describe what that process is, because I think that's important for people to be aware of, that it's truly, it's multiple people having conversations, and then we usually land in going into one direction. Ms. Olmstead.
Yeah, I'd like to make a comment of that. I've had a few people through emails or conversations that think, and I want to make this clear, that think it's a top-down decision or that Dr. Cartwright is making this decision for the entire district. Whether we're in person, virtual, what model we're in, how that matrix works, and that I want to thank you for sharing that, because that's not the case. It is the health department, the entire exec cabinet, we're all informed. This is a collaborative decision, not just you making this decision. So I wanted to make sure that, because that's some of the perception out there, so I wanted to make that very clear, that this isn't just one person in our district making the decision, and we are using the advice and the help from our health department and infectious disease doctors.
Correct. And I
Yes,
think that's a
that's
very important
important.
distinction.
It's infectious disease doctors and the health department that, are making these decisions, and not everybody agrees, but we're making the best decision of what the district needs to make, that the cabinet is and Dr. Cartwright is. And then that also goes in line with what you were saying, Barb, about that school districts are having trouble or having conversations with their liability insurance if you're not listening to your health department. That's what so that goes in line with that too, and I hope people know that and understand that those decisions are behind some of these too, that we've got to look at that also.
Absolutely. If you'll recall early on in the conversation with this, I said that it truly is a three-pronged test, oftentimes with the direction, because what will end up happening is you usually should be following the advisement of your health department, the advisement of your legal counsel, and then
Right.
also listening to your liability coverage insurance. Because if the health department is advising you to go one direction and you point blank say, you're telling me we can't do this, and they say, no, you shouldn't be doing this, then if something were to occur, then the district could be in a litigious situation from a liability perspective, because the
Right.
liability provider oftentimes will say, well, what advisement were you given? And if you were given that this is not the direction that you should be proceeding in, then you may not have coverage. I'm not going to say you will not have coverage, but you may not have coverage.
Right, okay.
And also, as I mentioned before, with the conversations that occur, it doesn't necessarily mean that we all agree. That's why we have the conversations.
Right. Oh.
In order to listen to a variety of different perspectives, and then for us to come to consensus and go into one direction.
Thank you.
I have two
Pearl.
questions. My first question is, what is a good response to community members who challenge the accuracy of our data and say that it's not accurate?
The data from the Winnebago Health Department?
Just the overall data.
Oh, okay.
Yeah, and I would say we can only report out on what is reported to us. So I mean, if somebody tests positive in the community and they don't alert the school, we're not going to know about it, So if you look at our data, I think it's an underrepresentation of the actual cases that we have in our district and our community. And I think that's not uncommon. If you look at the research that's been done by the CDC and other organizations, they would say that the number of cases that are actually out there are vastly underreported. And I think that's reflective in the fact that, just this week they came out with more information on how children are affected by the virus. And since the start of this, there's been over 1 million children, including infants, that have had COVID. And in the past week, we've had over 100,000 youths test positive, which is the most for a 1-week period since we started the pandemic. So, I don't know if that answers your question,
you're
but
good.
I would
Thank
say
you.
yes, that it may not be accurate, but that's because not everything is reported.
Yeah. And my second question is the same question I asked last time. We all want our kids back in school safely. So what can we do as a board, as a collective district? What can we do to slow the spread?
Yeah, and I think if you look at the CDC website and you listen to the infectious disease professionals, the three big things are, first and foremost, wearing masks, and wearing masks properly. If you're out and about in the community, I'm sure everybody has seen people wearing masks down around their chin or under their nose, and in order for them to be effective, they have to be worn the way they're supposed to be worn. The other important thing is maintaining distance from others. 6 feet is a recommendation, but if you can stay even further from others, you're going to reduce your risk related to contracting the virus. So, and that is important no matter what setting you're in. And then finally, washing your hands, using good hand hygiene. If you don't have a sink or soap available, using hand sanitizer whenever possible out in public. If there are areas that are commonly accessed in your building, in your home, making sure you're sanitizing those on a regular basis to try to prevent the spread.
Thank you, Nat.
And Ms. Carlin, also because I heard it directly from the U.S. General Surgeon for the United States, one of the comments that he made is also that there is a perception that oftentimes, okay, I have my little bubble, and it's my little group of friends and those kind of things. And what ends up happening is so many times that people don't recognize that you may have a bubble, I may have a bubble, we have a common friend. Now that bubble's not little bubbles anymore. It's actually a larger bubble. And then Miss Lodgy will have someone else that maybe is a common friend of your bubble, not my bubble, but now is actually, it spreads to my bubble. And what happens when you put air into a bubble, it'll eventually burst. And so the social gatherings, he says that that is actually one of the things that's occurring where they're finding a lot of spread there happening. So it may be having the party at your house in your backyard, having your child's friends over, unmasked, taking pictures, side by side, and different things like that, thinking that it's a small bubble, but unfortunately, because we all have our little bubbles, it's a huge bubble, and has a lot of risk associated with it. So I just wanted to highlight that as one of the things that is being recognized. Now I personalized it, but it is one of the things that we know is occurring, and unfortunately, it is contributing to spread.
Thank you.
Other comments or questions for Mr. Kemmer? Well, thank you. We appreciate your
Thanks, Matt.
ongoing updates for us.
Sure. Thank you.
Thank you. And if I may, Dr. Herzog, I
Yes.
have Dr. Pinkston with us this evening in order to give us an update for our Equity and Diversity Advisory Committee.
Very good. Welcome, Dr. Pinkston.
Good evening, Board. The committee had their second meeting held virtually on November 2nd. The committee continued to focus on drafting the vision statement, which will assist the work of the committee moving forward. The committee suggested that the following concepts be included in the vision statement: the need to create an environment in which parents feel safe, sharing urgent concerns regarding diversity and equity to school administration, the need to ensure an equitable and fair learning environment for all students, and a plan to address the achievement gap that exists for students of color. A survey was sent to the committee to solicit their feedback on the vision statement and also to identify topics that they are interested in as we continue our journey as a committee. And we will use the results from that survey to drive the work of the committee, to narrow the focus. Our most recent committee meeting was held on Monday, and we had a presentation on equity that was presented by Dr. Alfonso Simpson, who is the Director of African Studies for the University of Wisconsin at Oshkosh. Members of the community were able to interact and discuss and ask questions of Dr. Simpson on equity, and we discussed what equity means for us as a district, as well as what equity concerns members of the committee had. Are there any questions from the board?
Well, this certainly fits in with the strategic plan of the district to look at making sure that all means all when it comes to success of our students. So I'm really happy to know that this committee is underway, and I think it's very important to set a mission and a vision so that they know where they're going, because this is a very broad topic, and it's good to know where we're headed with this. So I thank you for your efforts in pulling this committee together and moving our district forward with that strategic goal. Thank you.
Thank you. I'd also like to recognize the efforts of Dr. Kim Brown and Ms. Linda Piron, who worked tirelessly with me on scheduling our meetings and keeping our committee members informed. And also, as I have mentioned to the board earlier, Dr. Brown and I will be presenting on December 2nd at the WASB-WASPO Committee on Equity, not only our district's equity journey, but also looking through my lens of human resources, what strategies our district is employing to increase the diversity within our district. I'm very honored to represent our district at this forum. We certainly don't have all of the answers, and this certainly is not a sprint, but rather a marathon. But we do want to celebrate what is going well within our district in this effort, as well as learn from other districts. So I look forward to continuing to update the board on the work of the committee.
Any comments or questions from other board members?
Great work.
Thank you, Belinda.
Thank you.
Thank you.
Very good. Thank you, Dr. Pinkston. With that, we will move on to board committee reports. I know we have at least 3 this evening, so I don't know who wants to lead off, but I know we have Education Committee, Policy and Governance, and also Facilities and Finance. So whoever would like to go next.
The Policy and Governance Committee meeting was on Monday, November 9th. All of them are on our board meeting as usual tonight, so I'm hoping everybody obviously got through them and read through them. I do want to make a note, though, of a couple. For the public, we had a new policy. It's for student mental health with Mr. Kramer. We requested that the policy, it did come, we had it last month, and then we wanted to change some wording, and then we brought it back. Regarding the parent notification, when students are receiving counseling and missing classes, they have to notify the parents. The new policy incorporates mental health service delivery models recommended by the Department of Public Instruction, including contracting with a healthcare provider in order to establish a clinic site on school grounds operated by the healthcare provider themselves. The policy provides an opportunity for the board to authorize the superintendent to pursue such arrangements, but it will still require the board's approval to have those sites at our schools. Another new policy also with Mr. Kramer was PPE, personal protective equipment during pandemic and epidemic events. This new policy enables the board to authorize administrators to implement and to adjust personal protective equipment requirements during a public health crisis situation. The intent of the new policy is to establish or implement any type of PPE requirements, but instead to establish the authority to do so and to provide some guidelines for such requirements. Neola, who does our, just for the public knows, who helps us and vets all of our policies, feels that flexibility and adaptability is critical in times of health and other crisis, and therefore this policy is designed to maintain a great amount of discretion and flexibility when it comes to implementation requirements and adjusting the changing of circumstances. All the rest of them were just, we deleted one because we deleted borrowing because it was added on to management of debt, and that was it. The rest of them were just small changes to some of the other ones and new updates from Neola. Our next meeting will be December 14th at 8:30 a.m. That's it.
Thank you, Mrs. Olmsted.
Thank you.
Mrs. Salaji?
I'll go next.
Okay.
Yes, the Education Committee met on Thursday, October 5th. We discussed the E-Academy enrollment numbers. The updated numbers as of November 3rd are 977 students in the E-Academy. Those numbers do not include the part-time high school students who traditionally in normal school years also enroll in E-Academy part-time. It just includes kind of our capture of this year's pandemic numbers. And then as mentioned in the superintendent's report, I'm just going to highlight it again, that families have the opportunity to transition students in or out of E-Academy right now until December 4th. And there is a website for E-Academy, and it was revamped to ease in locating information to assist families in making that decision. And there were also virtual information sessions where families could go to learn more about making that decision. The second portion of our meeting was about the educator effectiveness. Dr. Kim Brown provided information about the evidence-based evaluation system that the district currently uses. It is called the Charlotte-Danielson model. This system consists of 4 domains: planning and preparation, the classroom environment, instruction, and professional responsibilities. So those are the 4 categories teachers are evaluated on. Staff split into 3 groups, and they rotate. So in 1 year, they would have 2 formal evaluations conducted by principals. And then in the off years, the other 2 years, they have 2 mini observations. Principals have undergone intense training consisting of 40 hours of instruction followed by a test that requires a score of 80% or more to be able to provide non-biased, evidence-based evaluations. Retraining is done for any principal who does not pass with the 80% score until they achieve that. Beyond that initial training, there is a recalibration scheduled each year in an effort to keep principals current. The premise behind the system is that there are no biases, and scores should be the same regardless of who evaluates the employee. We talked about brand new teachers or veteran teachers who are new to the district are evaluated by principals to determine what level of the cycle is appropriate to place them in, and a great deal of support is provided before a plan of improvement is enacted, and in 3/4 of those cases, the educator does improve as the plan provides even more support to struggling teachers. Now, I had actually asked to know more about this back in the spring, but obviously it's different this year. So we talked also about how this will look different this year because the educator effectiveness was not designed to evaluate hybrid or fully virtual teaching. And so for that reason, Dr. Jones will be bringing a proposal to decide whether or not to waive the normal educator effectiveness evaluation scheduled for the 2020-2021 school year, as DPI is allowing that. A public hearing will be scheduled, and the board will vote on a resolution to waive the educator effectiveness evaluations for 1 year during an upcoming board meeting. The requirements for all staff and principals to complete their professional growth portion of the evaluation would remain, and all staff, regardless of what year they're on in that 3-year cycle, will have 2 mini observations during the 2020-2021 school year so that everyone receives feedback and observation. Everyone would also be frozen in that evaluation cycle, that 3-year cycle, and then the normal cycle would commence in the fall of 2021 because COVID will be gone by then, right?
Did you say that that's got to be approved by DPI?
Yes.
Okay.
If I remember it correctly, this was a few weeks ago, we will vote on it in an upcoming board, and then we send that to DPI, and DPI
Got it. Okay.
gives like a final yes or no.
Okay. Got it. Okay.
But DPI, I don't think that's a normal thing. DPI this year is saying you can
Right,
come up
they're
with
going- right,
with a
yeah.
separate plan
Okay.
to waive this, and that's our plan, is to have everyone evaluated in 2 mini sessions.
Okay.
To make it more fair, and because we talk about how everyone feels like a new teacher this year because it's a
Right.
new way of
Okay.
educating students. Thank you for that question. So our next meeting is December 3rd, and we will be going over the ESOL program. That's everything.
All right.
All right, thank you,
It's my
Mrs.
turn.
Szilagyi. And moving on to Mr. Evans.
The Facilities and Finance Committee met on November 12th, and I, as the vice chair, filled in for Allison. The first item was just questions on how the Finance Committee is going to moving forward with a new business manager. He was wondering what we wanted and what we didn't want, and we had a little discussion on that, but we felt it would be better to wait for the chair to be there so we can have a more robust conversation on what the Finance Committee is going to look like. We also had the building carryovers. I'm doing some sight reading here because I didn't have this earlier, so you might have to put up with it while I'm reading ahead of my voice. He is currently meeting with building principals to discuss building carryover funds. There's a new process would be based on a 3-year plan and earmark more capital needs by pooling the carryover funds. It can allow the district to do upgrades more quickly and potentially provide cost savings by doing group purchases instead of individual building purchases. Health premium holiday. When a new employee starts, the district charges them for 2 months of health premiums up front, which can financially be difficult for some employees. By charging 2 months up front, the district is always paying 1 month in advance. Running the premiums month to month is cleaner for onboarding and offboarding of employees. The current process is not effective from an accounting perspective. Nehans is requesting a health premium holiday for the month of December. The district will not charge health premiums to employees in the month of December. If board approval is not needed, the group agreed to proceed forward with the premium holiday. A variance report. We'll be starting to distribute monthly variance reports for the Finance and Facilities Committee. Would like the committee to review these reports prior to the next meeting and let him know if they'd like to continue receiving the reports or would like the items changed or adjusted as reports can be manipulated. He has a new program that puts out a pretty neat graph and charts and everything that he is using, which is a lot easier for me to understand just looking at a sheet of numbers on paper. GO Transit contract. The city of Oshkosh contacted the district to extend the GO Transit contract for additional 2 years at $30,000 per year. The city has agreed to assume the additional costs of the private donor for the first year of the agreement to extend the contract into a 3rd year. The city council will be discussing this topic further at the November 10th meeting. We have a long list of future agenda items, which I don't want to spoil by telling you what they are now, so we have a report to do. The next meeting is December 10th, and my prediction for the Tyrese Halliburton draft is top 5.
I actually have one question. Oh, go ahead.
Jackie, we need
just-
the list.
If I may, just an update for the city transportation
All of them?
The Go Transit program. That's under a proposal, so nothing has been finalized.
She needs to tell.
Nothing has been finalized at this point in time. I believe that this is a topic that's coming up, I believe at the next Common Council meeting. So once they meet on it, and if this is the direction that they would like to pursue from Common Council, then this will be coming back to the board for our review, for your review and final approval as well.
Has the Facilities and Finance Committee talked about a timeline for the new schools and whatnot? I'm already getting a few questions about when we're going to do that, and it's kind of exciting. So any news on that?
We have not done anything on that, and Kelly, you can correct me if I'm way off here, but seeing that the referendum had just passed about a week or so before that meeting, there wasn't anything to discuss.
We are preparing in order to provide updates on an ongoing manner, probably starting around February, to the board, so that as we pursue forward, the board will be kept informed as to the progress on that. As to the actual construction of the new facility, that's still yet a couple years away, because we do have the other projects in front of that, which was the infrastructure projects as well as the school safety and security measures.
Awesome. Thank you.
Thank you.
Other questions for Mr. Evans, Dr. Cartwright? All right, well, thank you to those board members with reports tonight. Good to keep all the rest of us as well as the public informed, so thank you. Next on the agenda is the non-agenda related public forum. We have several guidelines that we follow during this time. I just want to share those before our individuals who have signed up come to the table. First of all, we ask that you clearly state your name and address and the topic you wish to address. If you are acting as a spokesperson for a particular group of individuals, please indicate the group that you represent. Second, please clearly and concisely state the matters of concern. Number 3, please limit your comments to the time allotted, which is 3 minutes. And finally, remember that the use of specific names of district personnel may lead to legal liability. In such instances, you may pursue the district's formal complaint process by contacting the superintendent's office at 424-0160 to direct you to the appropriate administrator. We have 5 individuals tonight, and we will be starting with Sophia Rigoni.
Hello, my name is Sophia Rigoni, and I live on 4556 Bellhaven Lane. I'm an 8th grader in the Oshkosh Area School District at Krieger Middle School, and I'm here to talk about virtual learning. It has become clear to me and many other students in the community that we will not be going back to school this year based on the current metrics you are using. Because no matter what all the parents say, you have no intentions of changing your minds. I hope that you will consider listening to a student who is actually not at school and knows what it feels like. This shouldn't be all up to you. It should be up to parents and students. You can't say that you understand what we are going through because you don't, which is why I wanted to come here and use my voice to try to speak for all the other kids who want to go back. It's honestly disappointing to me and many others. You are taking away a basic right. Why can't we, like many other surrounding schools, go back? I personally struggle with being at home all day on a computer with no real socializing. I understand that most of the teachers are working very hard to help and are doing as much as they can. Although I struggle strongly with mental health, and school is one of the things that kept me motivated. I now have nothing to wake up and get ready for. No motivation, no socializing. Just the same thing every day. I cry. Sorry. Wake up, do what you can to get your work in. The students are hurting. I cry almost every day trying to work at home in frustration. I'm not learning anything either. I don't blame the teachers because they are doing the best they can. Me and many other students feel the same way about what we are learning. At this point, we might as well redo the grade. Studies have shown that masks work, so if we are social distancing, wearing masks, and cleaning tables, it is very unlikely that we will be able to get the virus at school. For the very few kids that are at high risk, and as well as the teachers, that they can stay virtual. But for those who aren't, please let us go back. Another key point that worries me is that school is a safe place for many students. Many students are abused, and being at home all the time isn't helping their case. Taking that away from them is very dangerous and harmful. Some kids don't even get fed at home and love the free breakfast at school. Just please let us go back. Thank you.
Thank you very much for coming tonight and sharing.
Thank you.
Next, we'll hear from Robert Rigoni.
Good evening, Rob Rigoni, 4556 Bellhaven Lane. My topic will be virtual schooling. My family and I have lived in Oshkosh for 11 years. We love this city, this community, and the people. We've been welcomed here with open arms, and we are greatly appreciative of that. I grew up in Michigan's Upper Peninsula in an old mining town. I was amongst the first generation to grow up without mining. I got first-hand look at what happens when a predominant employer leaves an area. Alcoholism, drug abuse, child neglect, child abuse, spousal abuse, and poverty. These social ills surrounded us. They were pervasive. For many of the children in the area, the only escape and healthy structure was school, and the only place to find role models was at school, the teachers. It was a teacher that inspired me to go to college and go on to pharmacy school, and I developed a lifelong love for learning. Thank you, Mr. Bothwell. The point is, I'm not sure we can emulate these types of interactions virtually, especially when home environments may not foster it. Whenever grand policy decisions like closing down schools are made, there are always what economists call externalities, which are side effects of unintended consequences, like an increased rate of child abuse, neglect, malnutrition, obesity, lost learning, and mental health issues like depression and suicide ideation. These consequences can last for decades. These externalities are clearly on the rise and have been reported in numerous medical journals. To quote a leading pediatrician from the Children's Hospital in San Francisco, as far as the children are concerned, the cure is worse than the disease. Many more children are harmed by not going to school than by going to school. The current COVID-19 infection fatality rate for children ages 0 to 19, reported by the CDC, is 0.003%, 3 out of 100,000 cases, with 3/4 of those children who have succumbed to COVID-19 having pre-existing conditions. Obviously, virtual learning is best suited for these high-risk individuals. We hear a lot about inequalities, especially in our economy. I think everyone in this room agrees the most effective way to close the inequality gap is through education. I then ask the question, can a child who is not living in a nurturing home or is lucky enough to have a parent or a guardian home with them excel in the virtual model? A recent estimate
30
places a
seconds, please.
hefty price tag on COVID-19 school closures to the tune of $2.5 trillion in lost future earnings. Economic analysis of school disruptions are associated with a 2 to 3% loss in annual income in a child's
15
lifetime.
seconds, please.
Kids today will face many challenges. They are not competing with their fellow Americans, they're competing globally. Globalization and automation will continue to challenge us. Jobs and careers that students are training for today
Excuse me.
will not
could you
exist in
finish up
10
in
years.
the next 15 seconds or so?
Almost done, sorry.
Thank you.
Children today will have to learn to be adaptable and lifelong learners. We can't afford to leave any children behind. It is my view, and many others, that closed schools for far too many children will exacerbate the inequality gap. My time is up. I wish I could say more. There's lots to say here. Thank you.
Mr. Rigoni, if you have additional comments, if you'd like to share those in written form, we can make sure that they're shared with the rest of the staff. I believe Dr. Jones is out in the hallway. He could make copies of whatever you have additionally to share. We'd be happy to receive that. Thank you, and thank you for coming tonight. Okay, next we have Stephanie Krieger. How do you pronounce that?
Krieger.
Thank you.
I am at 4447 Harbor Village in Amro, 54963. As I mentioned, me and my family live in Amro. We have open enrolled both of our children, currently in 5th and 7th grades, into the Oshkosh School District since they were both in kindergarten. But this year, my 5th grader decided to transfer to Amro. My 7th grader is still enrolled at OESD. We are still heavily invested in this district. I am here to support the returning of in-person school instruction. I'm hoping to keep my son at his current school, but my household has been very disheartened with the moment-to-moment decision-making. So I'm just going to take my time to verbalize the timeline we've had to deal with this school year. Week 1. A week before the start of school, the board decided to follow a model matrix system set up by the health department. This is a system that looks at county case numbers to decide in-person instruction for our schools and dismissed the individual school case numbers. When this happened, it immediately took an extreme measure of changing the Oshkosh Elementary School from full-time in-person learning to the hybrid model. Families and school staff in our district had to scramble last minute to make this work. After successfully going through the first 3 weeks in this hybrid version with minimal incidents in our schools, we received an email on Thursday, September 17th, saying that we were staying at the level 3 according to the matrix system, in place by you, keeping the students in the hybrid learning model. Ironically, the next day, Friday, September 17th, school district enrollment counts, which the tally numbers of the current enrolled students in our district, was performed by the state's Department of Public Instruction. I can't help but think that the school board, the school as you are, wanted their numbers to be as good as they could be at the time so you could receive more funding from the state. Because then, just 4 days later, Tuesday, September 22nd, we received another email from the district stating we are now level 4 in the matrix system and we'll be going virtual starting Thursday, the 24th. Once again, families and school staff had to scramble to figure this out in a 2-day period. I know for a fact, and I'm sure you all saw this coming, that our district lost several families to parochial schools, as well as other school districts in the area at this time. Then there's the referendum fiasco. Miraculously, on Election Day, November 3rd, OASD announced school would resume to a level 3 hybrid following Thursday, November 12th. This seemed intentional for timing and did effectively squash some animosity
30
towards the
seconds,
district
please.
in our community, so that the referendums passed effectively that day. We unfortunately saw the next part coming, but many of us, including myself, had false hope that the district leaders would do the right thing and follow what the promises made, especially since we have more knowledge about the virus and other schools in nearby districts have shown success with in-person learning. But
10
still,
seconds, please.
as we know, the matrix level changed again that Monday, November 9th, back to a level 4 virtual with no evidence or statistics or to substantiate the level that you had us at that point.
Could you
Coincidence?
finish?
I think not. I've understood from the previous board meetings that you would like the district families to trust you. Well, trust depends on transparency and communication from our district leaders. You have been very unsuccessful in doing this. This entire process has been very
Excuse
chaotic.
me, could you
and
finish in about
I will
15 seconds,
in a second.
please?
Thank you very
We've
much.
extended your time already.
Okay,
Thank
and
you.
confusing for my question. So my question is now, Ms. Cartwright, why are you allowing the health department to make these decisions, these crucial decisions for our families? We should have some say as district members and payers of what you guys make as far as a living. Thank you very much.
Thank you, Mrs. Krieger. And next we have Megan Casper.
Hello, Megan Casper, 3024 Holly Court. So tonight I'm here requesting a special public meeting with the board to have dialogue on the concerns of parents related to the inability of students to have an in-person option for learning. I agree with the recent decision to forego return to the hybrid model for now, given the current environment. However, this does not mean that we can sit back and wait. The virus is not going away, and we have to find ways to live with it, and I am not satisfied that children not being in the classroom for extended periods of time is the answer. By the time we get to January, students will have been out of the classroom for nearly an entire school year. This is especially critical for the elementary grades who can't self-teach. How does the district have any idea how children are doing in regards to their studies, and maybe more importantly, mentally and emotionally on a day-to-day basis? Our administration has created chaos and confusion surrounding this fundamental and essential service that I just don't understand. I read a very concerning article yesterday about the largest teachers union pushing for statewide metrics and guidance on when to shut schools down. I don't understand how the individual administrations can't handle these decisions based on their unique situations. It makes me question both the leadership and qualifications of these individuals. I also don't understand how the employees have such power and influence. Who is running the show? It would seem that some members of this group put themselves above all other essential workers, from the medical staff who are working 12 to 18-hour shifts, the food industry employees who ensure we can all eat, the daycare workers who are doing double duty taking kids that would normally be in your classrooms into their own, to everyone else who must show up to work every day. This includes me. I have a team of people who need me. I don't get to decide not to show up and do my job. I would not have a job, and that is the truth. This is even further confusing when it would seem the population the schools are working with are least vulnerable to the virus, both in terms of catching and spreading it. Risk to our student population is incredibly low, as it is to all age groups until around age 70. I'd like to understand how many staff you have of that age. Our student population is unfortunately most vulnerable when it comes to your services and lack thereof. We have made scared and afraid, which has debilitated us. When do we start talking about keeping kids in the classroom or getting them back to the classroom to keep up with the rest of the world who seems to be able to figure it out and prioritize this very important objective? I believe a meeting is in order to answer questions and to try to rebuild trust in our community with our educational leaders. There is no trust right now. We have lacked confidence from the beginning, which as it turned out was rightfully placed when just weeks into the school year, the administration went completely virtual. There are no prospects of a plan for return to the classroom, and the likelihood of follow-through on any plan you might deliver is
30
incredibly
seconds,
low
please.
based on prior experience. We have wasted so much time, and I am unsure whether this group understands the magnitude of those actions. I'm not meaning to be harsh, but this is the reality. You go home to a safe environment, you get to eat 3 meals a day, you have mastered your education, your
15
jobs will be
seconds,
here
please.
next year and the year after that. This is not true for many kids in our district. School is the safest place they have, even in a COVID-19 pandemic. Virtual learning is not good enough, and being physically in school is their best hope for their success. Some of our kids may never get over the non-medical consequences of COVID-19.
Could you finish in about 15 seconds, please?
I asked for the meeting to further discuss and work towards a plan to remedy this, and I will follow up with an email to proceed on my request. Thank you.
Thank you.
Thank you.
And next is Molly Boots.
Hi, Molly Boots, 3880 Crab Apple Lane. I've been here before, so thanks for letting me come back. Every organization in our community that provides a service to community members bases their work on their mission statement, vision statement, core values, and guiding principles. In review of all of those today, our school district is failing. Our vision, and I quote, "We will be the leader in education through innovation while focusing on the whole child." We are not leaders in innovation. Our kids sit and watch all the other schools in our area who are innovative, do in-person learning every day with the option for kids to learn via Zoom at home if they are quarantined or their family has chosen that option. In our area, we are anything but the innovative leaders. And focus on the whole child does not mean that having 6 total days of face-to-face contact with our children in almost 9 months, but sending information on mental health services in the meantime is not vision. It's a Band-Aid to cover real serious issues. Our mission, and I quote, "We will enrich our community by supporting our students to lead creative and empowered lives." It's hard for kids to be creative when they haven't been able to leave their homes in 9 months. Now, don't get me wrong, that's not the philosophy my family is following. However, not all students in the district have an opportunity for creativity and empowerment outside of school. I'm very grateful my children have organizations outside of the district that believe in their mission to empower and build my children every day and continue to provide services to the children in our community because it's important to their businesses and our students. However, let me repeat, that's not the case for many of our school district children. They deserve the chance to be in school, to be empowered by the mission statement our school board promotes. There are 6 total core values, however, I'm going to focus on 2 for time's sake. The first one, engage students and staff. My understanding from the discussions I've had with administration and teachers is that at this time, 25% of students right now are not engaged at all in their virtual learning. Also, the second core value I want to focus on is safe learning and working environment. It is my understanding as well that we have spent $700,000 to prepare our school for a safe learning environment, including plexiglass, masks, and hand sanitizers. Keep in mind that many other businesses and organizations are using this same exact safety equipment to remain open and operational for our community. And last but not least, our guiding principle, and I quote, "Students first." I don't see anything in the past few months that has shown the guiding principle of students first. I don't see it in the months to come. Our families told this
10
board
seconds,
that
please.
83% of us wanted our kids back in school for in-person learning full-time because it was best for the students. And it has been the only
Excuse me,
option
can you wrap
never
this up
talked
in
about.
15 seconds,
No
please?
matter what the data says, the reward of our kids being in school far outweighs their risk. I would ask this board and administration to have a plan, something for our kids to look forward to feel like they matter, to feel like they are first, for an in-person learning model for semester 2. Thank you guys so much.
Thank you, Molly.
Thank you.
All right. Thank our 5 presenters tonight and move on to agenda-related public forum. There was no one who signed up for that. So we will move on to the consent resolution agenda for this evening. For the consent agenda, the board has been furnished with background material on each item or has discussed it at a previous meeting. These will be acted upon with one vote without discussion. If a board member wants to discuss any item, it will be pulled out of the consent agenda and will be voted on separately. Pardon me, is there anyone who wanted to pull an item off of the agenda? I would like to pull item 6B this evening. So we will move on then with the rest of the consent agenda.
I think you need 5B.
I'm sorry, did I say 5A?
You said 6B.
Oh, I'm
You need
sorry.
5B,
All right, sorry.
since there is no 6B.
Thank you. I'm glad you all are paying attention. The board will consider approval of 1, minutes of October 19th, 2020 board retreat meeting. 2, minutes of October 28th, 2020 regular board meeting. Number 3, minutes of November 4th, 2020 regular board meeting. Number 4, bills payable. Number 5, personnel. A, temporary appointment, resignations and salaries. Oh, wait a minute, there's more. We're only halfway through here. Number 6, elementary Chromebook purchase. Number 7, Neola policy updates. A, 2260.02, English language proficiency. B, 8395, student mental health services new. C, 8450.01, personal protective equipment during pandemic/pandemic events new. D, 8390, animals on district property. E, 8900, fraud. F, 2450, community and adult education. G, 6145, borrowing, delete. H, 6147, debt management. I, 7230, gifts, grants, and bequests. J, 8710, insurance. K, 0172, legal counsel. L, 0162, quorum. M, 0164.2, special meetings. N, 0167.3, public comment at board meetings. O, 1220, employment of the superintendent. P, 1260, incapacity of the superintendent. Q, 1400.01, superintendent job description new. And number 8, 2019-2020 site carryover funds.
So moved.
Second.
Please call the roll.
Carlin?
Aye.
Evans?
Aye.
Herzog?
Aye.
Olmsted?
Aye.
Szilagyi?
Aye.
Motion carries.
Thank you very much. Resolution 5B. Be it resolved that the Oshkosh Area School District Board of Education approve the retirements as filed with the Secretary to the Board of Education.
So moved.
Second.
Thank you. I had asked that this be pulled because I think it's important that we recognize individuals who have dedicated years of their lives to improving the success of our students. And tonight we have 2 individuals who have announced their retirements. In the spirit of openness and transparency, I have to say that these are very personal for me because during my years as a central office administrator, I had the good fortune of working with both of these individuals. Ellen Binder is retiring as the office technical receptionist. She's been the face that most people see when they first come into the building, and she's done that for 25 years, starting in 1995. So we certainly want to wish Ellen all the best in her new venture as a soon-to-be retiree from the district. Besides serving as a receptionist, she also did a lot of work for me, as she now does for Drs. Jones and Gundlach in her current role. And the second retirement tonight is Lisa McLaughlin, middle school principal at South Park Middle School. She has been in the district for 27 years and has lent her time, energy, and expertise to being a solid leader for South Park Middle School and those students and their families. And so we also wish Lisa all the best as she starts her retirement. Are there other comments tonight on these 2 retirees?
They'll both be missed.
Do you want to speak up just a little
Oh,
bit?
sorry, no, I said, what you said was well said
Oh.
about both of them.
Thank
Yeah,
you,
so-
thank you. Well, every retirement is important. It's just that I had the good fortune of working closely with these individuals during my 20-plus years as a central office administrator. And so these really touched me when I saw these come through, but I'm also touched by the other ones, even if I haven't worked closely with them. It's important that we recognize the success of our employees and recognize the institutional memory that goes out the door when we lose good people. Please call the roll.
Evans?
Aye.
Herzog?
Aye.
Olmsted?
Aye.
Szilagyi?
Aye.
Carlin?
Aye.
Motion carries.
Okay, that was our individually considered resolution. Now we move on to a request for future agenda items. Are there any requests for future agenda items? Are there any announcements tonight? We do have another board meeting, not this month, but there are committee meetings that will take place. In fact, there's one tomorrow. There's a legislative committee meeting that will take place. And then we meet again in early December, the first Wednesday in December. With that, I would entertain a motion to adjourn.
So moved.
Please call the roll.
Who was the second, please? Carlin, thank you. I couldn't hear that. I apologize. Herzog?
Aye.
Olmsted?
Aye.
Szilagyi?
Aye.
Carlin?
Aye.
Evans?
Aye.
Meeting is adjourned.
Thank you.